In this video, we'll do an exam review on the basal ganglia, their functions, their connections, and the abnormal movements produced due to disorders of the basal ganglia. Few important exam questions. Question number 1, what's corpus striatum and lentiform nucleus? Number 2, what's the difference between bradykinesia and hypokinesia? Number 3, what neurotransmitter is released by Substantia nigra, and what's Ceruloplasmin deficiency? Now, basal ganglia. Basal ganglia are gray matter nuclei that lie in the cerebral hemisphere, and they include caudate nucleus, globus pallidus, and putamen. Other group is Substantia nigra, Subthalamic nucleus of Luys, and red nucleus. Three terms related to the first group of these nuclei: corpus striatum, and lentiform nucleus. In all these three, putamen is common. First, corpus striatum, that includes all the three: caudate nucleus, globus pallidus, and putamen. And striatum is putamen plus caudate nucleus, and lentiform nucleus is globus pallidus and putamen. So corpus striatum includes all the three of these. Striatum includes putamen and caudate nucleus, and lentiform nucleus includes putamen and globus pallidus. And in the other group, Substantia nigra has Nigrostriatal Dopaminergic system. Dopamine is inhibitory to the caudate nucleus, which is produced from Substantia nigra. Substantia nigra and the other one included in the basal ganglia, red nucleus, receives input from other basal ganglia, cerebral cortex and cerebellum. Now, connections of the basal ganglia briefly here. There are extensive connections to the motor and premotor cortex and suppressor strip to the striatum. Here is this, see here is a cerebral cortex, premotor cortex and suppressor strip projecting onto the striatum. Striatum then projects onto the Substantia nigra and to the globus pallidus. And globus pallidus has afferent and efferent connections via ansa reticularis to number 1 to the thalamus via globus pallidus interna and via globus pallidus externa to the subthalamic nucleus of Luys, and not shown here, globus pallidus also has projections to the red nucleus and parts of the brain stem. And then thalamic nuclei project in turn to the motor areas of the cortex here, and which projects to the striatum, thus completing feedback loop. Striatal flow is inhibitory to the thalamus. So cerebral cortex and suppressor strip projecting on striatum onto the Substantia nigra and the globus pallidus externa, and then to the subthalamic nuclei and globus pallidus interna to the thalamus, and thalamus projecting back onto the cerebral cortex and that to the striatum. And these red arrow indicate GABA, so the striatum projects on the thalamus by gamma aminobutyric acid, and the black arrow is glutamate that projects from thalamus to the cerebral cortex and from cerebral cortex to the striatum via glutamate. Now, functions of the basal ganglia. The basal ganglia are metabolically very active. Their oxygen consumption per gram of tissue is more than the cerebral cortex. Number 2, stimulation of the caudate nucleus decreases the stretch reflex. Stimulation of caudate nucleus and globus pallidus inhibits the movements evoked by cortical stimulation by Thalamo cortical feedback pathways. Number 3, neurons in the basal ganglia fire in a slow steady movements but not in rapid saccadic movement. And number 4, they start firing before the movement starts. That is, when the voluntary action is done by planning and programming, and they start firing when the voluntary movement is in the thoughts of the person. So they start firing before the movement and they fire in slow steady movements. Number 5, they are a part of the extrapyramidal system and control posture and movements primarily by inhibiting motor function. And number 6, they activate cortical inhibitory areas through Thalamo cortical feedback that decreases the movement. And you see the striatal flow to the thalamus is inhibitory, gamma aminobutyric acid, and thalamic flow is glutamate. Number 7, fiber feedback from caudate nucleus to the Substantia nigra also secrete GABA. And number 8, Nigrostriatal Dopaminergic system starts from Substantia nigra and ends at the caudate nucleus nucleus and releases dopamine, which is inhibitory to the caudate nucleus, whereas acetylcholine excites caudate nucleus. Few words about Substantia nigra. Copper is high in Substantia nigra and locus ceruleus. And in Wilson disease, there is hepatolenticular degeneration to the liver and lenticular nuclei. Why? Due to ceruloplasmin deficiency. In this condition, Wilson disease, copper deposits in the basal ganglia, especially in the lenticular nucleus. Substantia nigra and red nucleus receives input from other basal ganglia, cerebral cortex and cerebellum, as I earlier mentioned. Now, abnormal movements of basal ganglia disorders. They include akinesia, no movement. And what's bradykinesia? It's a slow movement. Hypokinesia is decreased amplitude of the movement. So bradykinesia is the slowness of movements and hypokinesia is decreased amplitude of movements. And hyperkinetic movements are excessive abnormal movements. The hypertonic movements may be rhythmic or arrhythmic. Rhythmic hyperkinetic disorders include tremors, tardive dyskinesia, and dystonic myorrhythmia. And what's tremors? Tremors are involuntary rhythmic oscillatory movements of the opposing muscles. And what are the features of tardive dyskinesia? Number 1, protrusion and rolling of the tongue. Number 2, sucking and smacking movements of the lip. Number 3, facial dyskinesia. And number 4, involuntary body and extremities movement. Now, rhythmic hyperkinetic disorders. Mnemonics for that is A, B, C, D, T. A for acetosis, B for balism and hemibalism, C for chorea, D for dystonia, and T for tics. We'll discuss them in the other videos separately. Parkinson's disease have both hyper and hypokinetic feature. And number 2, myoclonus may be rhythmic or arrhythmic. Now, answers to the questions. What's corpus, striatum and lentiform nucleus? Basal ganglia are gray matter nuclei that lie in the cerebral hemisphere, and they include caudate nucleus, globus pallidus, and putamen. Other group is Substantia nigra, subthalamic nucleus of Luys, and red nucleus. Three terms related to the first group of these nuclei: corpus striatum, and lentiform nucleus. In all these three, putamen is common. First, corpus striatum, that includes all the three: caudate nucleus, globus pallidus, and putamen. And striatum is putamen plus caudate nucleus, and lentiform nucleus is globus pallidus and putamen. Question number 2, what's the difference between bradykinesia and hypokinesia? Bradykinesia is the slowness of movement, and hypokinesia is decreased amplitude of movements. Question number 3, what's the neurotransmitters produced by Substantia nigra, and what substance is deposited in the Ceruloplasmin deficiency? Nigrostriatal Dopaminergic system starts from Substantia nigra and ends at caudate nucleus and releases dopamine. Dopamine is inhibitory to the caudate nucleus, whereas acetylcholine is excitatory to the caudate nucleus. Copper is high in Substantia nigra and locus ceruleus, and in Wilson disease there is hepatolenticular degeneration due to ceruloplasmin deficiency. In Wilson disease, copper deposits in basal ganglia, especially in the lenticular nucleus.